Greetings to all aspiring healthcare professionals and educators joining us from across the globe. I am Professor Dr. Anas Rashid, and it is my distinct pleasure to welcome you to our comprehensive and interdisciplinary journey through human anatomy. With European PhD in medicine, complemented by extensive postdoctoral training in experimental medicine, experimental surgery, and translational medicine, I bring to this series a deep-rooted passion for advancing knowledge and fostering collaborative learning experiences. Whether you aspire to become a physician, dentist, pharmacist, nurse, physical therapist, or veterinarian, the principles of human anatomy underpin your practice and influence patient care outcomes. Let's get started with Chapter 2, Perineum and Pelvis. Perineum is a diamond-shaped space that has same boundaries as inferior aperture of pelvis. Is bounded by pubic symphysis anteriorly, ischiopubic rami anterolaterally, ischial tuberosities laterally, sacrotuberous ligaments posterolaterally, and coccyx tip posteriorly. Has floor that is composed of skin and fascia and roof formed by pelvic diaphragm with its facial covering. Perineum is divided into anterior urogenital triangle and posterior anal triangle by line connecting to ischial tuberosities. We can see region of male perineum, pubic symphysis is here, scrotum, penis, glass of penis, perineal raphe, urogenital triangle, anal triangle, which is part of the perineal region, ischiopubic ramus, ischial tuberosity, anus, ischial spine, sacrum, coccyx. In this structure, we can also see the surgical perineum, posterior border of root of scrotum, lateral Cs of thigh, anterior border of anus, regions of female perineum, peripeus of clitoris, mons pubis, external urethral orifice, ischio, pubic ramus, labius majus, ischial tuberosity, peripheral raphe, ischial spine, anus. On the other side, labius minor, vagina, vaginal orifice, posterior labial commissure, urogenital triangle, anal triangle, which is in the perineal region, coccyx, sacrum, and then surgical gynecological perineum, posterior commissure of vagina, lateral Cs of thigh, anterior border of anus. Urogenital triangle, superficial perineal space or pouch, lies between inferior fascia of urogenital diaphragm, perineal membrane, and superficial fascia of perineum, that is known as Colles fascia. Contains superficial perineal space. Colles fascia is deep membranous layer of superficial perineal fascia and forms inferior boundary of superficial perineal pouch. Is continuous with dartos tunic of scrotum, dartos muscle and of penis, superficial fascia of penis, and with scarpa fascia of anterior abdominal wall. Deep perineal fascia is investing fascia of muscles in superficial perineal space, ischiocavernosus, bulbospongiosus, and superficial transverse perineal muscles. Male perineum and pelvis, we can see peritoneum, visceral pelvic fascia, superior fascia of pelvic diaphragm, inferior fascia of pelvic diaphragm, prostate gland, urogenital diaphragm, bulk fascia, superior fascia of urogenital diaphragm, inferior fascia of urogenital diaphragm, bulbospongiosus muscle and fascia, bulb of penis, superficial perineal space, superficial perineal fascia, that's also known as Colles fascia, ischiocavernosus muscle and fascia, crust of penis, pudendal canal, ischiorectal fossa of ureter internus muscle and fascia, bladder, frontal section of female, perineum and pelvis, vagina, peritoneum, visceral pelvic fascia, superior fascia pelvic diaphragm, inferior fascia pelvic diaphragm, superior fascia urogenital diaphragm. Then we have superficial perineal fascia, inferior fascia vaginal diaphragm, greater vestibular gland and orifice and its duct, labius major, bulbospongiosus muscle and fascia, superficial perineal space, vestibule bulb, ischiocavernosus muscle and fascia, curves of clitoris, pudendal canal, ischiorectal fossa, obturator internus muscle. Perineal membrane is inferior fascia urogenital diaphragm that forms boundary between deep and superficial perineal spaces. Urethra and vagina, females pass through membrane, lies between urogenital diaphragm and external genitalia, is perforated by urethra and is attached to posterior margin of urogenital diaphragm and ischiopubic rami, is thickened anteriorly to form transverse ligament of perineum and inserts into arcuate pubic ligament which spans subpubic angle just behind deep dorsal vein of penis. Muscles of superficial perineal space, ischiocavernosus muscle, arise from inner surface of ischial tuberosities and ischiopubic rami, inserts into corpus cavernosum, curves of penis or clitoris, are innervated by perineal pouch, a branch of pudendal nerve, assist in maintaining erection by penis by compressing curves and deep dorsal vein of penis, thereby hindering venous return. is covered by deep perineal investing fascia. Bulbospongiosal muscles arise from perineal body and fibrous raphe of bulb of penis in male and perineal body in female. Inserts into corpus spongiosum and perineal membrane in male and pubic arch and dorsum of clitoris in female. Eye innervated by perineal branch of perineal nerve. Compressed bulb in male, impeding venous return from penis, and thereby assisting in maintaining erection. Contraction along with the contraction of ischiocavernosus constricts corpus spongiosum, thereby expelling large drops of urine or final semen ejaculation. Compressed erectile tissue or vestibular bulbs in female and constrict vaginal orifice. Superficial transverse perineal muscle arises from ischial rami and tuberosities, inserts into perineal body. Central tendon is innervated by a perineal branch of pudendal nerve, stabilizes perineal body. Perineal body is central tendon of perineum, is fibromuscular mass located in center of perineum between anal canal and vagina or bulb of penis, serves as site of attachment for superficial and deep transverse perineal, bulbous spongiosus, levator ani, and external anal sphincter muscle. We can see here we have corpus cavernosum, corpus spongiosum, bulbous spongiosal muscle, ischiocavernosus muscle, urogenital diaphragm, superficial transverse perineal muscle, external anal sphincter muscle, levator ani muscle, gluteus maximus muscle, anococcygeal ligament, anal canal, perineal body, or central tendon in the male perineum. In the female perineum, glans, glioteris, urethral orifice, vaginal orifice, perineal body, central tendon, anal canal, anococcygeal ligament, bulbous spongious muscle, ischiocavernosal muscle, inferior fascia, vaginal diaphragm, superior transverse perineal muscle, external anal sphincter muscle, levator muscle, and gluteus maximus muscle can also be seen, as well as the coccyx. Greater vestibular or Bartholin glands lie in superficial perineal space deep to vestibular bulbs in female, are homologous to bulbourethral glands in male, are compressed during coitus and secrete mucus that lubricates vagina. Ducts open into vestibule between labia minora below hymen. Contents of superficial perineal pouch: male, roots of penis, bulb of crura. Here, both crura of the clitoris and bulb of the vestibule, superficial perineal muscles, bulbous spongious muscle, ischiocavernosal muscles, and superficial transverse perineal muscle. Here we have the same muscles. We have greater vestibular glands also in female, perineal branches of the internal pudendal nerve, pudendal vessels, and perineal branches of the pudendal nerve are all same in both male and female. Deep perineal space of pouch lies between superior and inferior fascia. Perineal membrane of urethral diaphragm contains deep transverse perineal muscle and sphincter urethra. Membranous part of urethra, bulbourethral glands in male, and branches of internal pudendal vessels and pudendal nerve. Muscles of deep perineal space. The deep transverse perineal muscle rise from inner surface of ischial rami, inserts into medial tendinous raphe in perineal body. In female, it also inserts into wall of vagina, is innervated by perineal branches of pudendal nerve, stabilizes perineal body, and supports prostate gland or vagina. Sphincter urethra arise from inferior pubic ramus, inserts into median tendinous raphe and perineal body, is innervated by perineal branch of pudendal nerve. Encircle and constitute membranous urethra in male, has inferior part that is attached to anterolateral wall of vagina in female, forming ureterovaginal sphincter that compresses both urethra and vagina. Urogenital diaphragm consists of deep transverse perineal muscle and sphincter urethra and is invested by superior and inferior fossae. Stretches between two pubic rami and ischial rami but does not reach pubic symphysis anteriorly. Inferior fascia perineal membrane provides attachment to bulb of penis, is pierced by membranous urethra in male and by urethra and vagina in female. Bulbourethral or Cooper gland lie within fibers of sphincter urethra in deep perineal pouch in male. On posterolateral sides of membranous urethra, ducts pass through inferior fascia urogenital diaphragm to open onto floor of bulbous portion of spongy penile urethra. Anal triangle, ischiorectal, ischioanal fossa is present space or either space side on anorectum and separated from pelvis by a levator ani and its fascia. Contains ischioanal fat which allows distension of anal canal during defecation. Inferior rectal nerves and vessel branches of internal pudendal vessels and pudendal nerve and perineal branches of posterior femoral cutaneous nerve which communicates with inferior rectal nerve. Contains pudendal alcock canal on its lateral wall. This is facial canal formed by split in obturator internus fascia and transmits pudendal nerve and internal pudendal vessels. Has falling borderies: anterior sphincter urethra and deep transverse perineal muscles, posterior gluteus maximus muscle and subsacrotuberous ligament, supromedial sphincter ani externus and levator ani muscles, lateral obturator fascia covering obturator internus muscle, floor skin over anal triangle, muscles of anal triangle. Obturator internus arise from inner surface of obturator membrane, has tendon that passes around lesser sciatic notch to insert into medial surface of greater trochanter of femur. is innervated by nerve to obturator, laterally rotates thigh. External anal sphincter arise from coccyx tape and anococcygeal ligament inserted into penile body is innervated by inferior rectal nerve and closes anus. Is composed of three parts: subcutaneous, superficial, which is main part attached to coccyx and central tendon, and deep. Corrugator cracotis ani muscle is the thin stratum of smooth muscle fibers radiating from superficial part of sphincter to deep aspect of perineal skin. Perianal skin, these fibers function to puncture that skin, giving rise to air-water tight seal of anal canal. You can see here we have sacral foramen, tendinous arch, obturator, internus muscle, obturator canal, anal canal, pubic crest, pubic symphysis, pubic tubercle. We have iliac fossa, piriformis muscle, coccygeus muscle, levator ani muscle, iliococcygeus, pubococcygeus, and puborectalis can also be seen in this diagram. The veterinary muscle rise from body of pubis, carpus, tendinous of veterinary, thinked part of obturator fascia and ischial spine, inserts into coccyx and coccygeal raphe or ligament, is innervated by branches of anterior rami of sacral nerve S3 and S4 and perineal branch of dental nerve. Spores and radius pelvic floor consist of pulborectalis, pulbo coccygeus and iliococcygeus is most anteromedial fibers comprise either levator prostate in males or vaginalis in female. Coccygeus arises from ischial spine and sacrospinous ligament, inserts into coccyx and lower part of sacrum, is innervated by branches of fourth and fifth sacral nerves, spores and raises pelvic floor. Then we have the anal canal, external genitalia and associated structures, fascia and ligaments. Spongiform ligament of penis arises from linea alba and membranous layer of superficial fascia of abdomen that is known as carpa fascia, splits into left and right parts, encircles body of penis and blends with superficial penile fascia that is known as daughter's fascia, enters septum of scrotum. Suspensory ligament of penis or clitoris arises from pubic symphysis and arcuate pubic ligament and inserts into deep fascia of penis that is known as fascia or into body of clitoris. Lies deep to fundiform ligaments. Deep fascia penis back fascia is continuation of deep perineal fascia. Perineal membrane is continuous with fascia covering external oblique muscle and rectus sheet. Tunica albuginea is dense fibrous layer that envelops both carpa cavernosa and corpus spongiosum is most dense around carpa cavernosa, thereby greatly impeding venous return and resulting in extreme rigidity of these structures when erectile tissue become engorged with blood. Is more elastic around corpus spongiosum, permitting passage of ejaculate during erection as chamber is much less turgid. It is also found deep to tunica vaginalis, where it projects into testes to provide access to tissues for nerves and vasculature. Tunica vaginalis is serous sac of peritoneum and covers front and sides of penis and epididymis, consists of parietal layer that forms innermost layer of scrotum and visceral layer adherent to testes and epididymis. Gubernaculum is male connects patches with floor of scrotum and coordinates that descent. In female forms mid-cord attachment to uterus and its two halves develop into ovarian ovary to uterus and around uterus to labia majora ligaments. We can see there we have mons pubis, anterior commission of labia majora, periphery of clitoris, pudendal cleft, glans of clitoris, frenulum of clitoris, external urethral orifice, labia minus, labia majus, opening of paraurethral ducts, vestibule of vagina, vaginal orifice, opening of greater vestibular or bulbar glands, hymen conical, vestibule fossa, and other structures can all be seen, including anus. In the male, we can see the skin of penis, deep back fascia of penis, superficial fascia of penis, and other structures, including great saphenous veins. We have ischio, pubic ramus, we have anus, we have other muscles over there. We can see here in triangles, perineum, surface anatomy, we have pubic symphysis, we have urinator triangle, we have ischiopubic ramus, ischial tuberosity, anal triangle, and tip of coccyx also can be seen in this figure. Male external genitalia scrotum is cutaneous pouch consisting of thin skin and underlying dartos, which is continuous with superficial penile fascia and superficial penile fascia. Coleus fascia dartos muscle is responsible for wrinkling scrotal skin, and cremaster muscle is responsible for elevating testes. It's covered with sparse hair and has no fat, which is important in maintaining temperature lower than rest of body for sperm production. Contains testes, epididymis, and their coverings. Is contracted and wrinkled when cold or excessively stimulated to increase its thickness and reduce heat loss, bringing testes into close contact with body to convert heat. It relaxes when warm and becomes flaccid and distended to dissipate heat. Receives blood from external pudendal arteries and posterior scrotal branches of inferior internal pudendal arteries. Is innervated by anterior scrotal branch of ilioinguinal nerve, genital branch of genitofemoral nerve, posterior scrotal branch of perineal branch of pudendal nerve, and perineal branch of posterior femoral cutaneous nerve. We can see here we have this subcutaneous fascia here, and all the structures can be seen in both these diagrams. Testes, and then we have penis, consist of three masses of vascular tissue. These are paired corpora cavernosa and midline corpus spongiosum that are bounded by tunica vaginalis. We can see that we have superficial dorsal vein, dorsal artery, dorsal nerve, deep dorsal veins, septum manis, deep artery of penis, skin, superficial fascia, deep buccal fascia, tunica albigiana, corpus cavernosum, and corpus spongiosum, as well as urethra. You can see here frenulum, skin, anus, and other ischial tuberosity and other tip of coccyx with the help of this figure. Consists of root, which includes two crura, and bulb of penis and body, which includes single corpus spongiosum and paired corpora cavernosa. Has head called glass penis, which is formed by a terminal part of corpus spongiosum and is covered by a free fold of skin. Periphuse, frenulum of periphuse is median ventral fold passing from deep surface of periphuse to inferior anterior-medial margin of corona of glans penis. Permanent margin of glans penis is corona. Median slit near tip of glans is external urethral orifice, and terminal dilated part of urethra is in glans is fossa navicularis. Perpetual gland are small sebaceous glands of corona, neck of glans penis, and inner surface of prepuce, which secretes odoriferous substance called magma. Female external genitalia. Labia majora are two language folds of skin that run infra-posteriorly from mons pubis and are joined together by both anterior and posterior labial commissures. Are homologous to scrotum of male. Their outer surfaces are covered with pigmented skin, and after puberty, labia majora are covered with hair. Contain terminations of round ligaments of uterus. Labia minora are hairless and contain no fat, unlike labia majora. Are derived into upper lateral folds which fuse above clitoris, fuse to form prefuse of clitoris, and lower medial folds which fuse below clitoris to form frenulum of clitoris. Flank and join posteriorly to vaginal orifice. Vestibule of vagina or genital sinus is space or cleft between labia minora, has opening for urethra, vagina, and ducts of greater vestibular gland in its floor. Clitoris is homologous to penis in male, consists of erectile tissue that is enlarged as a result of engorgement with blood and is not perforated by urethra. Consists of two crura, two corpora cavernosa, and glans, but no corpus spongiosum. Glans clitoris is derived from corpora cavernosa and is covered by sensitive epithelium. Bulbs of vestibule are homologous of bulb of penis of corpus spongiosum. Paired mass of erectile tissue on each side of vaginal orifice are covered by bulbous spongiosus muscle, and each bulb is joined to one another via undersurface of glans clitoris by a narrow band of erectile tissue. Nerve supply of perineal region. We have perineal nerve passes through greater sciatic foramen between piriformis and coccygeus muscles, crosses ischial spine, and enters perineum with internal perineal artery through lesser sciatic foramen, enters perineal canal along lateral wall of ischio-rectal fossa, give rise to inferior rectal nerve and perineal nerve, and terminates as dorsal nerve of penis or clitoris. Inferior rectal nerve arises within perineal canal, divides into several branches, crosses ischio-rectal fossa, and innervates sphincter and externus and skin around anus. Communicates in ischio-rectal fossa with perineal branch of posterior femoral cutaneous nerve with supplies scrotum or labia majora. You can also see in this diagram, perineal nerve arises within perineal canal and divides into deep branch which supplies all perineal muscles, and superficial posterior scrotal labial branch which supplies scrotum or labial majora. Dorsal nerve of penis of clitoris species perineal membrane runs between two layers of suspensory ligament of penis or clitoris and runs deep to deep fascia on dorsum of penis known as buccal fascia or clitoris to innervate skin, perfuse, and glands. Blood supply of perineal region. Internal perineal artery arises from internal iliac artery, passes through greater sciatic between foramen between piriformis and coccygeal muscle, crosses ischial spine, enters perineum and perineal nerve through lesser sciatic foramen, passes along lateral wall of ischio-rectal fossa in perineal canal, give rise to following branches. Inferior rectal artery arises within perineal canal, pierces wall of perineal canal, and breaks into several branches which cross ischio-rectal fossa to muscles and skin around anal canal. Perineal arteries supply superficial perineal muscles and give rise to transverse perineal branches and posterior scrotal or labial branches. Artery of bulb arises within deep perineal space, pierces perineal membrane, and supplies bulb of penis and bulbourethral glands in male, and vestibular bulb and greater vestibular gland in female. Urethral artery pierces perineal membrane and enters corpus spongiosum of penis and continues to glans penis. Deep arteries of penis sclerotis are terminal branches of internal perineal artery, which perineal membrane run through center of corpus cavernosum of penis or clitoris and fly its rectal tissue. Dorsal arteries of penis or clitoris spread perineal membrane and pass through suspensory ligament of penis clitoris, run along its dorsum on each side of deep dorsal vein and deep to deep fascia, back fascia, and superficial to tunica albuginea to supply glands and perfuse. External perineal artery rise from femoral artery, emerges through saphenous ring and passes immediately over spermatic cord or round ligament of uterus to supply skin above pubis, penis, and scrotum of labium majora. Veins of penis. Deep dorsal vein of penis is unpaired vein that lies in dorsal midline deep to deep back fascia and superficial to tunica albuginea. Leaves perineum through gap between arcuate pubic ligament and transverse perineal ligament and drains into prostatic and pelvic venous plexus, is compressed by deep fascia of penis, back fascia upon involvement of tight tissue, thus inhibiting venous drainage as major venous drainage of penis is a major contributing factor to maintenance of erection. Superficial dorsal vein of penis runs towards pelvic symphysis between superficial dartrus and deep back fascia and terminates in external superficial perineal veins which drain into greater splenius vein. Lymph nodes and vessels. Lymphatic drainage of perineum occurs via superficial inguinal lymph nodes, which receive lymph from lower abdominal wall, buttocks, penis, scrotum, labia majora, and lower parts of vagina and canal. These nodes have afferent vessels that drain primarily into external iliac nodes and ultimately to lumbar or aortic nodes. Lymph vessels from glans, penis, sclerotis, and labia minora pass to deep inguinal external iliac nodes. We can see here we have common iliac nodes, internal iliac nodes, we have lumbar aortic nodes, internal iliac nodes, external iliac nodes, deep inguinal nodes, and superficial inguinal nodes. Lymphatic drainage of pelvis follows internal iliac vessels to internal iliac nodes and subsequently to lumbar aortic nodes. Internal iliac nodes receive lymph from upper part of rectum and vagina and other pelvic organs, and they drain into common iliac and then to lumbar aortic nodes. However, lymph from uppermost part of rectum drains into inferior mesenteric nodes and then to lumbar aortic nodes. Lymph from testes, epididymis, or ovary drains along gonadal vessel directly into lumbar aortic nodes. So that is the lymphograph of pelvis and lumbar region. Pelvis. Bony pelvis. Pelvis is bassin-shaped ring of bone formed by two hip bones, the sacrum and coccyx. Hip or coxal bone consists of ilium, ischium, and pubis. Is derived by pelvic brim or iliopectineal line into pelvis major, false pelvis above, and pelvis minor to pelvis below. Has outlet that is closed by coccygenes and elevator and eye muscles, which form floor of pelvis. Is normal tilt in anatomical position, thus anterior superior iliac spine and pubic tubercles are in same vertical plane. Coccyx is in same horizontal plane as upper margin of pubic symphysis. Axis of pelvic cavity running through central point of inlet and outlet almost parallel to curvature of sacrum. You can see that we have iliac fossa, promontory, body, ischial spine, iliopectineal line, pubic symphysis, pubic tubercle, anterior inferior iliac spine, iliopubic eminence can also be seen in both male and female pelvis. Upper pelvic aperture or pelvic inlet or pelvic brim is superior rim of pelvic cavity and bounded posteriorly by a promontory of sacrum and anterior border of ala of sacrum, sacral part laterally by arcuate or iliopectineal line of ilium, iliac part, and interiorly by pectineal line, pubic rest, and superior margin of pubic symphysis, pubic part. Is measured by using transverse, oblique, and anterior posterior conjugate diameters. Is crossed by ureter, gonadal vessels, median sacral vessels, iliolumbar vessels, sympathetic trunk, lumbosacral trunk, pituitary nerve, sympathetic cord, spermatic cord, round ligament of uterus, and suspensory ligament of ovary. Lower pelvic aperture, pelvic outlet is diamond-shaped aperture bounded posteriorly by sacrum and coccyx, laterally by axial tuberosities and sacrotuberous ligaments, and anteriorly by pubic symphysis, arcuate pubic ligament, and rami of pubis and ischium. Is closed by pelvic and digital diaphragms. Pelvis major, false pelvis is expanded portion of bony pelvis above pelvic brim. It supports abdominal contents and aids in supporting gravid uterus. Pelvic minor, true pelvis is gravity of pelvis below pelvic brim or superior aperture and above pelvic outlet or inferior aperture, has outlet that is closed by coccygenes and levator muscles and superior perineal fascia which forms floor of pelvis. Let's see the difference between male and female bones. Smaller, lighter, thinner. Male, larger, heavier, thicker. Inlet transversely oval, heart-shaped. Outlet larger than male, smaller. Cavity wider, shallower. Male, narrower, deeper. Subpubic angle larger, greater. Male, smaller, lesser. Sacrum shorter, wider. Male, longer, narrower. Opposite foramen in female, oval or triangular. In male, round. Joints of pelvis. Lumbosacral joint is joined between vertebra L5 and base of sacrum, joined by intervertebral disc and supported by iliolumbar ligaments. Iliac joint is synovial joint of irregular plane type between articular surfaces of sacrum and ilium, is covered by cartilage and is supported by anterior, posterior, intero, serious, ingero, caesius, sacroiliac ligaments transmit weight of body to hip bone. Sacrococcygeal joint is cartilaginous joint between sacrum and coccyx, reinforced by anterior, posterior, and lateral sacrococcygeal ligaments. Pubic symphysis is cartilaginous or fibrocartilaginous joint between pubic bones in median plane. We can see that the ilium, ala, sacroiliac joint, sacrum, acetabulum, pubic symphysis, ischium. We have sacral 1, 2, 3, 4, pubic bone, iliac crest, sacral promontory. Also, we can see that the ligaments over here, greater sciatic notch, ischial tuberosities, and femur and sciatic nerves and iliolumbar ligaments over there. Pelvic diaphragm forms pelvic floor and supports all of pelvic. Fissura is formed by elevated and and coccygeal muscles, and their facial coverings lies posterior and deep to ugenital diaphragm and medial and deep to rectal fossa. On contraction, raises the entire pelvic floor, flexes anorectal canal during defecation, and helps voluntary control of micturition, helps direct fetal head towards birth canal at parturition. We can see the liver internine muscles, pubococcygenius, iliococcygenius, then we have coccygenius, tendinous arch, anorectal hiatus, hiatus for urethra. Then we have liver internine, again pubococcygenius, iliococcygenius, obstetra internus, coccyx, piriformis, posterior side, anterior side, symphysis pubis, or pubis symphysis, vaginal diaphragm, urethra, vagina, and canal, liver internine, coccygenius, and this is makeup of pelvic diaphragm. Ureter and uribladder. Ureter is muscular tube that transmits urine by peristaltic waves. Has three sections along its course at its origin when a renal pelvis joins ureter where it crosses the pelvic brim and at its junction with bladder crosses the pelvic brim in front of the bifurcation of common iliac artery, descends retroperitonally on lateral pelvic wall and runs medial to umbilical artery and obstetric vessels and posterior to ovary, forming posterior boundary of ovarian fossa. In female, it is distal accompanied in its course by a trend artery which runs above anterior to it in base of upward ligament of uterus. In male, it passes posterior inferior to ductus deferens and lies in front of seminal vesicle before entering posterior lateral aspects of bladder. We can see that we have urinary bladder, we have ureter, ductus deferens, seminal vesicle, apula of ductus deferens, prostate, issue, pubic ramus, bulbourethral glands, bladder. We have seminal vesicle, central zone, then we have peripheral zone, ejaculatory duct, urethra, transition zone can also be seen. Enters obliquely through base of bladder and opens by a slit-like orifice that acts as valve and circular fibers of intramural part of urethra as sphincter when bladder is distended. Valve and sphincter injections prevent deflux of urine from bladder into urethra. Receive blood from aorta and renal, groinal, common and internal iliac, umbilical, superior and inferior vesicle, and middle rectal arteries. We can see the male urogenital organs, posterior view of bladder and male accessory organs, as well as mid-sagittal view of prostate gland showing prostatic zones. Urinary bladder is situated below peritoneum and is slightly lower in female than in male. Extend spirally above pelvic brim into abdominal cavity as it fills, apex projects anterospirally towards pubic symphysis and fundus or base, form this posterior-inferior triangular portion. Has neck, which is area between where fundus and inferior lateral surfaces come together, leading to urethra. Has uvula, which is small eminence at apex of its trigone or projecting into orifice of urethra. Trigone is bounded by two orifices of urethra and internal urethral orifice around which thick circular muscle, smooth muscle layer called internal sphincter or sphincter vesicae is there. Has bundle of smooth muscle fiber in its wall, known as the detrusor muscle of bladder. Receive blood from superior and inferior vesical artery and from vaginal artery in female. Its venous blood is drained by prostatic or vesical plexus of vein, which empties into internal iliac vein. Is innervated by nerve fibers from vesicle and prostatic plexus. Parasympathetic nerve, pelvic splanchnic nerve originating from S2 to S4 stimulate contraction of musculature that is detrusor of bladder wall, minorly contribute to relaxation of internal uterine sphincter and promoting emptying. Sympathetic nerve constrict internal uterine sphincter and trigone region of bladder. Sympathetic fiber also innervates vasculature of bladder. We can see male and female urinary bladder and urethra. Left side we have male, right side we have female. So we can see the peritoneum, neck of bladder, fundus of bladder, body of urinary bladder. Then we have ductus deferens, uvula of bladder, prostatic fascia, and then other muscles are also can be seen. Vestibular bulb over there in female, we have ureter, rage, there's a muscle, bladder, neck, we have the urethra, external urethral orifice, urinary diaphragm can also be seen in this diagram. Urethra is serves as passage from urine bladder to exterior, but in men it also has passage from semen. Male urethra is approximately 20 cm long and consists of three parts: prostatic, membranous, and spongy. Lowest part of membranous urethra is susceptible to rupture or to penetration by catheter. Female urethra is approximately 4 cm long and its external urethral orifice is situated between labia minora, anterior to vaginal opening and posterior to glans clitoris. Male urethra is supplied by urethral artery, whereas female urethra is supplied by vaginal and inferior vesical arteries. Micturition, which is known as urination, is initiated by stimulating such represented to the muscle in bladder wall. As urine volume increases, approximately 400 ml for adults, can be assisted by contraction of abdominal muscle, which increases intra-abdominal and pelvic pressures. Involve following processes: sympathetic visceral efferent fibers constrict internal sphincter, inhibiting emptying. They also activate during ejaculation to constrict internal sphincter in order to prevent seminal reflux into bladder. Visceral efferent impulses rise from stretches sepsis in bladder wall and enter spinal cord S2 S4 via pelvic splenic nerves. Parasympathetic pregnenologic visceral efferent fibers in pelvic splenic nerves pass through pelvic inferior gastric plexus to synapse within bladder wall. Postganglial fibers of bladder musculature induce reflex contraction of the reducer muscle and relaxation of internal urethral sphincter in concert with reduced stimulation by sympathetic fibers. Somatic efferent fibers in perineal nerve cause voluntary relaxation of external urethral sphincter and bladder begins to void. At end of micturition, that is urination, external urethral sphincter muscles contract and pelvis perineal muscles in male expel large few drops of urine from urethra. Male genital organ. Testes develop retroperitoneally and descends to scrotum retroperitoneally. Is covered by tunica albuginea, which lies beneath visceral layer of tunica vaginalis, produces spermatozoa within seminiferous tubules and interstitial cells of lytic, secrete testosterone, is supplied by testicular artery from abdominal aorta and drained by penis veins of pempiniform plexus into testicular veins, of which left drains to left renal vein and right drains directly to inferior vena cava. Has lymph vessels that descend with testicular vessel and drain into lumbar aortic node, lymphatic vessel into the cotton drain, into superficial lingual nodes. Epididymis is convoluted duct, approximately 6 meters, 20 feet long, that connects efferent ductules of testes to ductus. Deferens consists of head, body, and tail, functions in maturation and storage of spermatozoa. Ductus deferens is continuous with tail of epididymis and serves to transport sperm to ejaculate duct prior to ejaculation. Is a thin walled tube that is sent within spermatic cord to enter pelvis at deep in one ring, later to inferior gastric artery, crosses medial side of umbilical artery and abdominal nerve and vessels, passes superior to urethra near wall of bladder and is dilated to become ampulla and its terminal part at base of prostate. Innervation is primarily from postganglionic sympathetic nerves of pelvic plexus. There is called peristaltic contractions that propels spermatozoa into ejaculatory duct. Ejaculatory ducts are formed by union of ductus deferens with ductus of seminal vesicles, as can be seen in these diagrams. Peristaltic contraction of muscular layer of ductus deferens and ejaculatory ducts propels spermatozoa within seminal fluid into urethra, open into prostatic urethra or seminal colliculus just lateral to blind prostatic article. Seminal vesicles are enclosed by dense endopelvic fascia and are lobulated glandular structures that are diverticular of ductal deferens, lie inferior and lateral to ampulla of ductal deferens, gains fundus, base of shoulder, boulder, bladder, produce alkaline secretion containing procteus and choline, which will be mixed with contents of ductal deferens and secretion of prostate and bulbous glands to make up of seminal fluid. Have lower ends that become narrow and form ducts which join ampulla of ductal deferens to form ejaculatory ducts. Do not store spermatozoa as was once thought. This is done by epididymis, ductal deferens, and its ampulla. We can see bladder, urethra, ejaculatory duct, ampulla of ductal deferens, seminal vesicle, prostate gland, membranous urethra, pubourethral gland, ductus deferens, epididymis, testes, corpus of penis, bulb of penis, corpus spongiosum, glans penis, corpus cavernosum. We can also see different things in over also in this diagram. Prostate gland is located at base of urinary bladder and consists chiefly of glandular tissue mixed with smooth muscle and fibrous tissue. Has four zone, anterior zone or isthmus which lies in front of urethra and void of glandular substance. Transitory zone which encompasses central proximal to ejaculatory ducts and is prone to benign hypertrophy obstructing internal urethral orifice. Central zone which encompasses ejaculatory ducts up to urethra and peripheral zone which is situated posterior, inferior and lateral to transitional and central zones forming main mass of gland and is thus most prone to carcinomatous formation. Secretes fluid that produces characteristic odor of semen. This fluid secretion from seminal vesicles and bulbous glands and spermatozoa constitutes semen or seminal fluid. Secretes prostate-specific antigen, prostaglandin, citric acid, and acid phosphatase, and proteolytic enzymes. Has ducts that open into prostatic sinus groove on either side of urethral crest. Receives ejaculatory duct within which open into urethra or seminal colliculus just lateral to blind Prosthetic article. Urethral crest is located on posterior wall of prosthetic urethra, which has numerous openings for prosthetic ducts on either side, has ovoid-shaped enlargement called seminal collicles or vano montanum, upon which two ejector ducts open at summit of colliculus in prosthetic article, which is invagination blind pouch approximately 5 millimeter deep. It is analogous to uterus and vagina in female. Prosthetic sinus is grooved between urethral crest and wall of prosthetic urethra and receive ducts of prostate gland. Erection depends on stimulation of parasympathetic from pelvic splanchnic nerves, which directs arteries supplying erectile tissue and thus causing engorgement of corpora cavernosa and corpus spongiosum, compressing veins and thus impeding venous return and causing fall. Erection is also maintained by contraction of bulbous spongiosus and ischiocavernosus muscles, which compresses erectile tissue of bulb and crus. Is often described using popular mnemonic point erection by parasympathetic and shoot ejaculation by sympathetic. Ejaculation begins with nervous stimulation, function friction to glans penis and other sexual stimuli, resulting in excitation of sympathetic fibers, leading to contraction of smooth muscle or epididymal duct, duct deferens, and seminal vesicles, and prostate in turn occurs as a result of contraction of smooth muscles, thus pushing spermatozoa and secretion of both seminal vesicles and prostate into prostatic urethra, where they join secretions from bulbourethral and penile urethral glands. All of these secretions are ejected together from within the urethra because of rhythmic contractions of bulbous spongiosus, which compresses the urethra. Involves contraction of sphincter of bladder, preventing entry of urine into prostatic urethra and reflex of semen into bladder. Female genital organs, ovaries lie on posterior aspect of broad ligament on side wall of pelvic minor and are bounded by external and internal iliac vessels and not covered by peritoneum, and thus ovum or oocyte is expelled into peritoneal cavity and then into uterine tube. Are not enclosed in broad ligament, but their interior surface is attached to posterior layer of broad ligament by mesovarium. Have surface that is covered by a germinal columnar epithelium, which is modified from developmental peritoneal covering of the ovary, are supplied primarily by ovarian arteries, which are contained in suspensory ligament and anastomose with branches of uterine artery, are drained by ovarian veins. Right uterine vein joins infravena cava, left uterine vein joins left renal vein. Uterine tubes extend from uterus to uterine end of ovaries and connect uterine cavity to peritoneal cavity, and each subdivided into four parts: uterine part, isthmus, ampulla, which is the largest and widest part, and infundibulum, funnel-shaped termination formed by fimbriae. Convey fertilized or unfertilized oocytes to uterus by ciliary action and muscular contraction. Transport spermatozoa in opposite direction toward the egg. Fertilization takes place within tube, usually in infundibulum or ampulla. Fertilization is initiated by penetration of secondary oocyte by oosperm and completed by fusion of male and female pronuclei. Uterus, we can see here that internal ossia, endocervical canal, cervix, external ossia, cervix, ovary, fallopian tube, uterus, cervix, rectum, bladder, urethra, vagina, and anus. Uterus is organ of gestation where fertilized oocyte may normally embeds and developing fetus grows until its birth is normally anteverted angle of 90 degree at junction of vagina and cervical canal and anti-flexed angle of 160 to 170 degree at junction of cervix and body is supported by pelvic diaphragm, genital diaphragm, bulbocervical, sacrocervical, and uterine round broad lateral or transverse cervical cardinal ligaments. Is supplied primarily by uterine artery and secondarily by ovarian artery. Has anterior surface that, when in normal anteverted or anteflex, rotation rests on posterior superior surface of bladder. Is divided. Uterus is divided into four parts for purpose of description. Fundus is rounded part of uterus located superior anterior to plane of entrance of uterine tube. Body is main part of uterus located inferior to fundus and superior to isthmus. Uterine cavity is triangular in a coronal section and is continuous with lumina of uterine tube and with internal ossia. Isthmus is considered part of uterus located between body and cervix of uterus. It corresponds to internal ossia. Cervix is the inferior narrow part of uterus that projects into vagina and divides into follicular region. Internal ossia, junction of cervical canal within uterine tube, uterine body, cervical canal, cavity of cervix between internal and external ossia, external ossia, opening of cervical canal into vagina. You can see that fundus cavity, ovarian artery, body, internal ossia, uterine artery, isthmus, ureter, cervical canal, fallopian tubes, lateral formex, external ossia, vagina. We can also see mons pubis, clitoris hood, clitoris, outer labia, inner labia, urethra, vestibule, harsh line, vaginal opening, hymen, vestibular glands, perineum, anus. We can see clitoris, clitoral hood, urethra, vestibule, harsh line, opening of shared glands, hymen. We can see here frenulum of clitoris, harsh line, labia minora, frenulum of labia minora, vestibule of vagina, labia majora, minora, frenulum of labia minora, glans of clitoris and prepuce of the clitoris. Vagina extends between vestibule and cervix of uterus, is located at lower end of birth canal, serves as excretory channel for products of menstruation, also serves to receive penis during coitus, has fornix that forms recess between cervix and wall of vagina, open externally into vestibule and is partially closed by membranous crescentic fold. Hymen is supported by elevator ani, transverse cervical, pubocervical, and sacrocervical ligaments. Upper part, genital diaphragm, middle part, and perineal body, lower part. Receives blood from vaginal branches of uterine artery and internal iliac artery. Has lymphatic drainage in two directions: lymphatic from upper three-fourths drain into internal lymph nodes, and lymphatic from lower one-fourth below hymen drain downward to perineum and thus into superficial inguinal nodes. Is innervated by nerves derived from uterovaginal plexus for upper three-fourths and by deep perineal branch of pudendal nerve for lower one-fourth. Rectum and anal canal. Rectum is part of large intestine that extends from sigmoid colon to anal canal and follows curvature of sacrum and coccyx. Has lower dilated part called ampulla, which lies immediately above pelvic diaphragm and stored feces. Has peritoneal covering on its anterior right and left side of proximal third, only anteriorly for middle third, and no covering for distal third. Has mucous membrane and circular layer, muscular layer that form three permanent transverse fold, Hausen walls, which appear to support fecal mass. Receive blood from superior, medial, and inferior rectal arteries. Middle sacral artery, specifically superior rectal artery, pierces muscular wall and occurs courses in submucosal layer and anastomosis with branches of inferior rectal artery. Middle rectal artery supplies posterior part of rectum. Has venous blood that returns to portal venous system via superior rectal vein and caval systemic system via middle and inferior rectal veins. Middle rectal vein, pyramidal drain, muscular layer of the lower part of rectum and upper part of anal canal. Receives parasympathetic nerve fiber by way of pelvic splanchnic nerve. We can see above pectinate line, epithelium is columnar or bridal, below stratified squamous, venous drainage, portal venous system, below caval venous system, lymphatics, internal iliac nodes, here superficial inguinal nodes, sensory innervation. Above pectinate line is visceral sensory, below pectinate line is somatic sensory, hemorrhoids. Above pectinate line known as internal hemorrhoids, below pectinate line is known as external hemorrhoids. Anal canal lies below pelvic diaphragm and is at anus, divided into upper two-thirds visceral portion which belongs to intestine and lower one-third somatic portion which belongs to the perineum. With respect to mucosa, blood supply and nerve supply, has anal columns which are 5 to 10 longitudinal mucosal fluid in its upper half. Each column contains small artery and small vein. Has anal walls which are crescent-shaped mucosal fold that connect lower ends of anal columns. Has anal sinuses which are series of pouch-like Stenosis at lower end of anal canal column in which anal glands open. Internal anal sphincter, thickening of circular smooth muscle in lower part of the rectum, is separated from external anal sphincter, external skeletal muscle that has three parts, subcutaneous, superficial, and deep, by intramuscular intrasphincteric groove called Hilton White line. Has point of demarcation between visceral and somatic portion called pectinate dentate line, which is serrated line following anal walls and crossing bases of anal columns. Epithelium is columnar cuboidal above pectinate line and stratified squamous below it. Venous drainage above pectinate line enters into portal venous system primarily via superior rectal vein. Below rectal line, it enters into caval system via middle and inferior rectal veins. Lymphatic vessels drain into internal iliac nodes above line into superficial inguinal nodes below it. Sensory innervation above pectinate line is through visceral afferent fibers in pelvic plexus. Sensory innervation below pectinate line is by somatic nerve fibers of renal nerve which are very sensitive. Internal hemorrhoids occur above pectinate line and external hemorrhoids occur below pectinate line. Defecation is initiated by distension of rectum filled from sigmoid colon, and afferent impulses are transmitted to spinal cord by pelvic splanchnic nerve. Pelvic splanchnic nerve increases peristalsis, contracts smooth muscle in rectum. In contrast, pathetic nerve causes decrease in peristalsis, maintain tone in intersphincter, and contains vasomotor and sensory pain fibers. Defecation involves following intra-abdominal pressure is increased by holding breath and contracting diaphragm, abdominal muscles, and levator ani, thus facilitating expulsion of feces. Pulborectalis relaxes, which decreases the angle between ampulla of rectum and upper portion of anal canal, thus facilitating defecation. Smooth muscle in wall of rectum contracts, internal anal sphincter relaxes, external anal sphincter relaxes to pass feces. After evacuation, contraction of pulborectalis and anal sphincters closes anal canal. Blood vessels of pelvis can be seen in this diagram. Internal iliac artery arises from bifurcation of common iliac artery in front of sacroiliac joint and is crossed anteriorly by ureter at pelvic brim. It's commonly divided into posterior division, which gives rise to iliolumbar, laterosacral, and superior gluteal arteries, and anterior division, which gives rise to inferior gluteal, internal pudendal, umbilical, obturator, inferior vesical, medial rectal, and uterine arteries. Iliolumbar artery runs superior laterally by iliac fossa deep to psoas major, divides into iliac branch supplying iliacus muscle, ilium, and lumbar branch supplying psoas major major and quadratus lumborum muscle. Lateral sacral artery passes medially in front of sacral plexus, giving rise to spinal branches, which enter interior sacral foramina to supply spinal meninges and roots of sacral nerves, and then emerge through posterior sacral foramina to supply muscle and skin overlying sacrum. Superior gluteal artery most commonly runs posteriorly between lumbosacral trunk and first sacral nerve, leaves pelvis through greater sciatic foramen above piriformis nasal to supply muscles in buttocks. Inferior gluteal artery runs posteriorly to reach gluteal region between either first, second, and third sacral nerves, leaves pelvis through greater sciatic foramen inferior to piriformis. Internal pudendal artery leaves pelvis through greater sciatic foramen passing between piriformis and coccygeal muscles, then hooks around dorsal aspect of ischial spine to enter ischiorectal fossa through lesser sciatic foramen. Umbilical artery runs forward along lateral pelvic wall and long side of palator, has proximal part that gives rise to superior vesical artery that supplies superior part of bladder and distal ureter. In male, superior vesical artery gives rise to artery of ductal deferens, which supplies ductal deferens, seminal vesicles, lower part of ureter and bladder. Has distal part that is obliterated and continues to forward as medial umbilical ligament. Obturator artery typically arises from internal iliac artery and runs anteriorly towards obturator foramen. It enters medial thigh through obturator canal, divided into anterior and posterior branches and supply thigh muscles. Runs through upper part of obturator foramen. Acetabular branch enters joint through acetabular notch and reaches head of femur by way of ligamentum capitis femoris. In approximately 20 to 30% of population, the obturator artery rises from inferior epigastric artery. Inferior vesical artery occurs in male and corresponds to vaginal artery. In female, supplies fundus of bladder, prostate gland, seminal vesicle, ductus deferens, and lower part of ureter. Vaginal artery arises from uterine or internal iliac artery, gives rise to numerous branches to anterior and posterior wall of vagina, and makes longitudinal anastomosis to in median plane to form anterior and posterior azygous arteries of vagina. Medial rectal artery runs medially to supply mainly muscular layer of lower part of rectum and upper part of anal canal. Also supplies prostate gland and seminal vesicles of vagina and ureter. Uterine artery is homologous to artery of ductal deferens in male, arises from internal iliac artery or in common and with vaginal or middle rectal artery. Runs medially in base of broad ligament to reach junction of cervix and body of uterus, runs in front of and above uterus near lateral fornix of vagina, then ascends along margin of uterus and ends by anastomosing with ovarian artery. Divided into large superior branch that ascends along lateral margin of uterus, supplies bloody and fundus of uterus, and ends by anastomosing with ovarian artery. Smaller vaginal branch supplies cervix and vagina. Medial sacral artery is an unpaired artery rising from posterior aspect of abdominal aorta just before its bifurcation, descends in front of sacrum, supplying posterior portion of rectum, and ends in coccygeal body, with small cellular and vascular mass located in front of coccyx tip. Superior rectal artery is direct continuation of inferior mesenteric artery. Ovarian artery rises from abdominal aorta, crosses proximal end of external iliac artery to enter pelvic minor and reaches ovary through suspensory ligament of ovary. Veins of pelvis, major veins generally follow arteries and are named accordingly. These veins are often found to originate from venous plexi of same name as organs with which they associate and drain. Lymphatic vessels follow internal iliac vessels to internal iliac nodes to common iliac nodes and then to lumbar or aortic nodes. Drain from rectum upper part along superior rectal vessels, inferior mesenteric nodes, and then lumbar aortic nodes. Lymph vessels from ovary, uterine tube, and fundus follow uterine artery and drain into lumbar aortic nodes. Lymph vessels from uterine body and cervix and bladder drain into internal and external iliac nodes. Lymph vessels from prostate and rectum lower part drain into internal iliac nodes. Nerve supply to plexus. Pelvis, sacral plexus is formed by fourth and fifth lumbar ventral rami, lumbosacral trunk, and first four sacral ventral rami lies largely on the internal surface of piriformis muscle in pelvis. Superior gluteal nerve L4 to S1 leaves pelvis through greater sciatic foramen above piriformis. Inner weights gluteus medius, gluteus minimus, and tendus fascia lata muscles. Inferior gluteal nerve from L1 to S2 leaves pelvis through greater sciatic foramen below the piriformis. Innervates gluteus maximus muscle. Sciatic nerve L4 to S3 is largest nerve in body and is composed of peroneal and tibial parts. Normally leaves pelvis through greater sciatic foramen below piriformis but can pass over, bifurcate around, or penetrate through piriformis. Enters thigh in hollow between ischial tuberosity and greater trochanter of femur. Nerve to obturator internus muscle from L5 to S2 leaves pelvis through greater sciatic foramen below piriformis, enters perineum through lesser sciatic foramen, innervates obturator internus and superior gemellus muscles. Nerve to quadratus femoris muscle from L1 to S1 leaves pelvis through greater sciatic foramen below piriformis, descends deep to gemelli and obturator internus muscle, and ends in deep surface of quadratus femoris, supplying quadratus femoris and inferior gemellus muscles. Posterior femoral cutaneous nerve from S1 to S3 leaves pelvis through greater sciatic foramen below Piriformis lies alongside sciatic nerve and descends on the back of knee, give rise to several inferior cluneal nerves and perineal branches. Perineal nerve from S2 to S4 leaves pelvis through greater sciatic foramen below piriformis, enters perineum through lesser sciatic foramen and perineal canal in lateral wall of ischiorectal fossa. Its branches are described in section on nerves of perineal region. Branches distributed to pelvis include nerve to piriformis muscle S1 to S2, nerve to levator ani and coccygeal muscle S3 S4, nerve to external anal sphincter muscle, and pelvic branching muscle that is S2 to S4. Autonomy nerve, superior hypogastric plexus, continuation of aortic plexus, below aortic bifurcation and receive lower to lumbar branching nerves, lies behind peritoneum, is descend in front of fifth lumbar vertebra and by bifurcation into right and left hypogastric nerves in front of sacrum, contains preganglionic and postganglionic sympathetic fibers, visceral afferent fibers, and few, if any, parasympathetic fibers which may run recurrent course through inferior hypogastric plexus. Hypogastric nerve are inferior lateral extension of superior hypogastric plexus and lies in extraperitoneal connective tissue lateral to septum. Provides branches to sigmoid colon and ascending colon. Inferior hypogastric or pelvic plexus is formed by union of hypogastric, pelvic splanchnic, and sacral splanchnic nerves and lies against pectorolateral pelvic wall lateral to rectum, vagina, and base of bladder. Contains pelvic ganglia in which both sympathetic and parasympathetic preganglionic fibers lie in naps. Hence, it consists of preganglionic and postganglionic sympathetic fibers, preganglionic and postganglionic parasympathetic fibers, and visceral afferent fibers. Gives rise to subsidiary plexus including middle rectal plexus, uterovaginal plexus, vesical plexus, differential plexus, and prosthetic plexus. Sacral splanchnic nerves consist of mix of both preganglionic and postganglionic sympathetic fibers, predominantly postganglionic. Those that come off chain as preganglionics commonly synapse in inferior epigastric or pelvic plexus. Preganglionic cell bodies are located in lateral horn at spinal cord level L2, L2, L1, L2, course anteromedially from sacral sympathetic chain into inferior epigastric pelvic plexus. Pelvic splanchnic nervi arrogantis arise from sacral segment of spinal cord S2, S4 and are only splanchnic nerves that carry sympathetic fibers. All of the splanchnic nerves are sympathetic. Contribute to formation of inferior hypogastric pelvic plexus and supply descending colon, sigmoid colon, and other viscera in pelvis and perineum. Questions with answer. Perineum is diamond shaped. Perineum is divided into anterior ugentral triangle, posterior anal triangle. Main exogenitally are scrotum, testes, and penis. Female exogenitally are labia majora, labia minora, vestibula vagina or urogenital sinus, clitoris, bulbs of vestibule. Muscles of superficial perineal space are ischiocavernosus muscle, bulbospongiosus muscle, superficial transverse perineal muscle. 5 boundaries of anal triangle are anterior, posterior, superior-medial, lateral, and floor. Nerves of perineal region are inferior rectal nerve, perineal nerve, dorsal nerve of penis or clitoris. Main blood vessels of perineal region include internal pudendal artery, external pudendal artery, deep dorsal vein of penis or clitoris, superficial dorsal vein of penis or clitoris. Joints of pelvis are lumbosacral joint, sacroiliac joint, sacrococcygeal joint, pubic symphysis. Sternum consists of manubrium, sternal angle or angle of Lewis, body, xiphoid process.